Well, hello and welcome to Ask Dr. Furlong and Ask Dr. Sane on Facebook Live. We're really excited for today's 15-minute episode where we've got two special guests here. To my left is Carole Stanford, our customer care coordinator here at Furlong Vision. She's been with us since 2015, and her son McKinley, I brought him along because both Carole and her son McKinley had advanced all laser LASIK here, and we're going to talk to them about their stories. Now, I did McKinley's surgery a couple of years ago, and Dr. Sane did Carole's surgery very recently, so we're going to go into kind of the details of that in just a minute. First, I wanted to welcome everybody. Welcome, Carole.
Welcome. Thank you.
Dr. Sane, thank you for rejoining us, and McKinley, welcome.
Thank you for having me.
So we're going to start with Carole's story, and this is Dr. Sane who did Carole's surgery recently. I'm going to have Dr. Sane take over and talk a little bit about what Carole's vision problems were and what we were hoping to achieve. Dr. Sane.
Thank you, and let me begin by welcoming Carole and McKinley again.
Thank you.
Welcome to this episode of Facebook Live. I'd like to begin by telling what Carole was having. Her main visual problem was difficulty in seeing things up close. Her distance vision was fairly okay. It wasn't perfect because she had a bit of astigmatism, but the main problem was difficulty in focusing things at a close distance, for which she had to be relying on glasses to do things like reading, writing, working at the computer. And she had her laser vision correction done 2 weeks ago. So if Carole, you could tell us how your near vision problems were affecting your quality of life, your activities, and why and when you decided to do something about it in the form of laser vision correction.
Absolutely, I'll be happy to tell you. So for about 10 years, I started noticing that my up-close vision was giving me problems. My world currently is more up close than it used to be at distance. So I'm often on my computer. I wrote a book. I'll throw that in and let you know a little bit about that. I'm also in front of patients and getting them prepared for this procedure wearing reading glasses. I also use my cell phone a lot. I use it as my alarm. So a lot of patients would talk about their alarm being across the room and not being able to see that, and I couldn't relate. Well, my cell phone's my alarm clock, and then I could relate because I couldn't see it anymore. And so I was getting more and more frustrated with it. We looked at a couple of options. We looked at time, we looked at obligation, we looked at when I'd be able to do something about it. And I just got tired of waiting and made a decision to do something about it. I think when I noticed it the most is last year when I was writing the book that I'm writing, or I wrote, which again we showed, cheap plug, the book that I wrote, that I would be writing, or I was on my computer, or I was proofreading pages, and I couldn't see them. And you probably can't see it from here, but writing like this, I could not see. So that was difficult for me. Talking to patients where I was looking down at their paperwork and at a computer, and then back at the patient became troublesome. So we made the decision to do something about it, like Dr. Sane said. I just said, forget it, let's get this done. Dr. Sane, would you do me the honor? She said yes. We tested what we call monovision, and we did it, and for almost 30 years I've been helping people achieve their dreams. And I'm not really a crier, so I'm not going to cry. Okay, I lied. But in any event, I didn't realize the impact it would have on me. Again, I've seen thousands of these procedures. I've been a part of them. And because I didn't need it like other people did, I really kind of just took it for granted, at least where I'm concerned. So when we did do it, the next day I could see my cell phone, I could see at a distance, I could see small print like this, but I could still drive. My life, I feel like I got all of my life back. For a while I thought, okay, I have about 75% of my life, and the rest of it is finding my reading glasses all over the house. Well, that's gone now. So I honestly believe I'm now at what should have been 100% almost 10 years ago. But thanks to Dr. Sane, I have it now.
So tell us a little bit about how you felt undergoing the procedure, what you felt about your vision once you had the LASIK done with the monovision. Did it help in achieving your goals of seeing both far and near? Were you comfortable with it? Did you require some time to get adjusted to it?
I didn't feel like I did, because obviously I work in the field, and I was trying it a mild way, and then we did the trial frame here in the office, and within minutes I felt like it was achieving what I wanted. So I thought if I could just get what I got with that trial frame, I was going to be happy. But what I actually got exceeded it. So it gave me, I just did not know it was going to be this much. And I knew it would be easy. I was not nervous. Patients were asking me all day if I was nervous. I wasn't nervous, but I am hyper. Probably can tell this. So I did take something to help me relax so I'd be a good patient. Dr. Sane is an outstanding surgeon, but I did not want her to have to deal with my hyperactivity. So the procedure was easy. The recovery was easy. The results are outstanding. It probably sounds ridiculous, but having done this for so many years, I did not imagine it was going to exceed my expectations like this.
Great. Well, I'm so glad and so excited for you that LASIK with monovision is helping you to see better both at far and distance, and it's working really well for you.
It's fabulous.
Great. At this point, I would like to say a little bit about what presbyopia is and also about the option of monovision. Presbyopia, it sounds like a fancy name. It's basically a visual condition which affects people in their early or mid or late 40s. It happens to most of us, almost all of us, where your near vision starts becoming blurred and it makes it hard for you to see things well up close. The treatment for this is to wear reading glasses, also called readers or cheaters. And the reason for this is age-related changes that happen in the muscles of the eye and within the lens. So when you're younger, your muscles in the eye which help you focus are strong, and the lens is pretty flexible, and that helps you in seeing things well at a close distance. But with age, there are certain changes which happen in the muscle and in the lens. The lens becomes less flexible, the muscle becomes a bit weaker, and therefore near vision becomes blurred. If you are in that age group and you want to reduce the dependence on your reading glasses and at the same time be able to see well at distance and at close, then there is an option of something called monovision. This is a way of treating your eyes such that one eye is treated for distance and sees well things at a far distance, and the other eye is treated and set for up close. So with that combination of one eye for far, one eye for near, you are able to see things really well at all the distances. So it's a great option for that category of patients. And we always offer this option, we always discuss these strategies with patients who are in their 40s or beyond to see if this is something that they would like. And before going down that path, we always like to give it a trial in our clinic. We have you come in, we have the patients come in before the day of surgery. We try temporary glasses with different lens prescription or contact lens with different lens prescription, such that both far and near vision is good with each eye separately. And if you think you like that combination, then we do that. It kind of gives you an idea about how things are going to appear with monovision, and it also helps you in deciding whether you like that combination or not. So I'm very glad that monovision with LASIK, LASIK with monovision really helped Carole. And having discussed about presbyopia and monovision and her excellent visual outcome, let's turn to Dr. Furlong and Mick.
Just before we do that, so that's a great story. We got another great story over here. 1 minute, tell us what your book is called and why you wrote it and what's in it.
Thank you, Dr. Furlong. So my book is called Growing Up Navy, and I'm just going to switch out really quickly. I grew up in a military family. Dr. Sane talked a little bit about being over 40, so I'm just going to throw it out there. I'm 56, and I grew up in a military family. My mother and father started having kids from 1954 to 1964, so that's a lot of kids in a short time. And so I wrote a book to honor my father, what my father is as a person and who he is as a veteran. As a result of that, I also followed in his footsteps and joined the Navy later. So I wrote this book about, like I said, about a year ago, and it was to honor my dad. And there was a lot of stuff that had to be done. And honestly, I really feel like if I had monovision then, this would have been a lot easier. So.
Well, thank you for that. And Carole's been in the eye care industry for decades, so she knows a lot about eyes. She knows a lot about what she was getting herself into, and chose, of course, my excellent associate here, Dr. Sane, to do a procedure. We've got potentially a better story over here, so I'm just going to talk to you about it. So McKinley and I both had LASIK because we couldn't see anything far away. Everything up close was fine, but when you're a kid, your world is not just like here, it's like when you're playing sports and all that kind of stuff, right? So 2 years ago we did LASIK on you. Tell us a little bit about why you chose to do it, what kind of difficulties you were having with your vision before, and then your experience.
I decided to have LASIK because I've always hated glasses. It's always just been in the way. Whenever you have to wake up and you have to put contacts in, or you have to remember to take them out before you go to sleep, that's always
Sorry, Mom's here.
I'm sorry.
It's a little obnoxious, so I'll go ahead and say my world's definitely changed, like just in like little details like that, but in things like when I go outside and I look at the mountains and now I can see everything in detail. Like before, it's just blur, color, just colors, and not even that far. I could just go outside right now and 100 feet away, just colors. But now I can see everything. It's amazing. Like my world has definitely changed. I would do it again and again and again and again if my vision kept getting worse. Like
So his vision was about 20/400 without glasses before, and in our office when patients have surgery we test their vision, and everybody kind of has heard what 20/20 is, and some people out there know what 20/15 is. Well, we never used to have the ability to test vision better than that. A couple of years back we changed our monitors in our office and we can go all the way down to 20/10, and you can read that. So 20/10 vision is really rare, and it's basically, if you look at the 20/20 line and you can just make it out, try walking 20 feet further away from that and you'd still be able to read it. That's what his level of vision is. So very happy for you. The technology today was able to give him that. Did you want to add
Oh yeah,
something?
I'm
Tell
sure.
us something.
He does not tell him the whole story.
Okay.
As his mother, when McKinley was born, you could see he has large eyes, and of course I've been in the field for a long time. So as soon as I saw his face and I saw his eyes bigger than his whole face, I said, long eye, he will be wearing glasses. So he started wearing them since he was in kindergarten. And he hated them so much, I had to buy 3 pairs. And I'd hide one in his backpack that he didn't know about, one in the nurse's office, and 1 pair he'd be wearing. And he had the brand that you can't break. Well, he broke them every day. And so fortunately I got them at cost. So he would go to his teacher and say, my glasses are broken, I can't wear them. And I tell the teacher, he has some in his backpack. Well, he learned about that. So I had to hide some at the nurse's office. So no, he hated them. He would sleep in his contact lenses, and he's always loved martial arts. So that's the thing now that I'm starting to see with him, is before he was born, I was forced to go see Mortal Kombat. And even inside of my tummy, he was thumping while we were watching that movie. And then when he was 2, his brother was taking karate, and he was this tiny little thing, and he wanted to be in. So they wrapped the belt around him like 3 times and let him bow, and he thought he was doing something. But now he can do jujitsu, and he told me, and he forgot to tell you, so I'm telling it, I'm the mother. So he told me he feels safer because he has his peripheral vision as well. And so you don't have that when you're in glasses, and he knows that. And when you sleep in your contacts, you clearly don't have that. But in any event, so there's things that I've seen from a mother's standpoint that, like, for him, he's still super excited. But from a mom's standpoint, I've seen him grow in areas that I underestimated. And not that I underestimated him, I just didn't know that was gonna come out then. So it's as excited as he is, it's actually even more so for me. From the
Well,
other
we're
side.
going to take a few questions because we want to get through a few questions. If you're going to submit any questions online, we also want you to vote Team Furlong or Team Sane. Which is the better story? Which is the better outcome? You let us know, and we'll let you know the results. So we'll
2010.
I need to win.
we'll go to a couple of questions right now.
I need to win.
Mick, talk about how your experience was. What were you expecting when you were going to have LASIK, and how was it with it?
In terms of, was I concerned or worried?
Were you worried? Yeah.
No,
was it?
As Dr. Furlong said, my mom has been in this ever since I was born, so I've been groomed to be comfortable with it. Like, I've seen many people do this and no problems at all, so I already knew when I was going into this there was going to be no issues.
That's great. Are there any negatives to monovision?
Well, monovision, as I said, is a great option for people who are having problems with reading, but they want to reduce their dependence on glasses. Some people cannot get adjusted to monovision, some people can get adjusted. And that's why we like to try it out in our clinic to see if your brain can adjust to that combination of 1 eye for far, 1 eye for near. Having said that, the eye that we focus for up close, it's not super close, it's somewhere over here, like reading distance, because we don't want to create too much of a difference between the far eye and the near eye, because your brain might not be able to adjust to it. And if there's too much of a difference, it can affect your depth perception to some degree. So we do trial and error and pick the best lenses which help you in preserving your stereoscope or your depth perception, and at the same time give you good vision for far and near.
Is it common for great vision or poor vision to run in families?
Yeah, visual difficulties like nearsightedness tend to run in families. Usually when you're nearsighted, one parent typically is nearsighted, and Carole was not nearsighted, so I would have assumed.
McKinley's grandmother, two aunts, and were at least -5. And his dad was -5.
Right.
They've had LASIK.
There you go. So that it does tend to run in families, and in my family, all 4 of my brothers were nearsighted like I was. My sister, perfect vision her whole life, although she could benefit from monovision now because she hates her glasses up
Come
close.
see us.
Here's a question, how does your vision affect your job now? And I guess we can go to each of you for that.
Okay, I'll go really quickly. It makes mine a lot easier. I can also look at patients, patients are coming here to be less dependent or not wear glasses. And it's me going back and forth with glasses that is a little disconcerting. Patients don't always understand why I'm wearing glasses. So I'm not wearing them now, so I don't have that I don't have to explain that anymore. And I was already excited about what I do, but now I'm super excited about what I do.
That's
So,
great.
yeah.
At work, I often have to deal with a lot of people and a lot of packages, and I have to like look down to see things ahead of time and like plan things out. So it helps me to see the small numbers on packages that let me know where they're gonna go ahead of time, so I can plan ahead. And then I'll have to drive cars around, and it helps me with navigating, because obviously my vision is very helpful for that. That is pretty much.
Were your friends surprised when they saw that now you don't have to use contacts or glasses, and did that also get them?
My friends are still jealous, actually. I still boast about it.
Yeah.
Even today, before I came here, I was explaining to one of them how LASIK is really awesome for me, and she should get it herself. She's afraid of the laser, and I keep telling her there's nothing to be worried about.
That's good. That's a good testament. I think we have time for one more question, and then we'll wrap up our segment today.
Considering the age gap between the two of you, when is the common age when people can start getting LASIK or monovision?
Yeah, so when you're nearsighted, the problem is that you do need glasses to see well in the distance, and that is usually from anywhere from birth up until through adolescence. So the younger our patients are, they tend to be on the nearsighted side, because farsighted patients typically don't have vision problems. Their eyes are able to focus when those muscles are nice and young. So our youngest age patients are usually about age 18. We do want to make sure that their prescription of their glasses has been stable, so we check for that as well. And then as people get older, that's when that discussion of monovision becomes more in depth, because those patients are already dealing with that problem by wearing bifocals or by wearing contact lenses for distance, and then sometimes reading glasses on top of that as well. Probably the best way to find this out, if you're having any of those vision difficulties we've talked about, whether your near vision is good and distance is blurry or vice versa, give us a call, come in, we'll do a free evaluation, see if you're a candidate for any of the laser treatments that we do. Plus, we also do other surgeries as well, like cataract surgery and lens replacements. We'll be able to give you an honest opinion as to what you might be a good candidate for. If you have any other questions that we didn't get to today, please, you can submit them by just typing them in and submitting them, and we'll get to those later today. And thank you for attending Ask Dr. Furlong and Ask Dr. Sane Facebook Live segment. Thank you, Carole. Thank you, McKinley. Thank you, Dr. Sane.
Thank
It was
you.
my pleasure. I was like, you are not getting
Nice job.
I was like, you are not
Nice job.
getting
No, you're good.
Are you kidding me?
You were good. Okay, we have patients starting to come in now,
Yeah.
so.
That was pretty good.
Thank you for
Thank you.
talking about the book.